The topic going to be artificial intelligence in carotid artery disease. I'll be presented by Dr. Tatum Jackson from UK and Jack Parker from Finland.
Right. Good morning. My name is Dr. Tatum Jackson, and I would like to thank Dr. Ramaiah for the opportunity to present again at the TED conference. Will be speaking this morning alongside my colleague Jack Parker, CEO and co-founder of the AI company Iatella. We are coming to you live from the UK and Finland, and pleased to be presenting our work alongside the Arizona Heart Foundation regarding the clinical applications of AI in carotid artery disease. Next slide, Jeff. Next slide. So following on from Dr. Abaram's talk, our study asks in part a similar question: how to identify and define vulnerable carotid plaques, those that predispose patients to high risk of ipsilateral stroke despite symptom presentation, in order to initiate the appropriate intervention. We aim to do so through the modality of AI. Next slide. Carotid plaque morphology has been of interest to vascular surgeons for many years. This is largely due in part to the work of Drs. Lesby and Wheel-Gray in the 1980s. Next slide. To date, there are certain elements of carotid artery plaques which are known to be at risk of developing a stroke in patients followed over time. This evidence comes predominantly from the study of over 1,000 patients in the asymptomatic carotid stenosis and risk of stroke study. It has been demonstrated by Professor Andrew Nicolaides and the AC-SRS study that the important characteristics which classify a plaque as high or low risk include the following: the amount of plaque, the echolucency of the plaque as measured by the gray scale median, and the presence of small discrete white areas within the plaque as demonstrated here by their significant p-values. Next slide. These large studies have also shown that plaques lacking a thin fibrous cap, referred to as a juxtaluminal black area, are at significantly high risk of causing a cerebrovascular accident. These large studies have shown it's no longer simply through the degree of stenosis in which a patient's risk of stroke is defined, it is through plaque characteristics. At the present time, due to operator dependence and time-consuming limitations, very few people are assessing carotid plaque morphology to determine the appropriate treatment of patients. I would like to hand over to Jack to explain in more detail how we are utilizing AI to characterize and risk stratify carotid plaques to further plan appropriate interventions.
Yes, thank you, Dr. Jackson. So yes, knowing the characteristics of plaques, thanks to Dr. Nicolaides et al., we designed a series of work to train an AI model to detect, quantify, and then, as Dr. Jackson said, characterize the plaque. So we came to you last year where we presented the very early results of the AI model, in which you're seeing here. This model was trained on 50 annotated videos of the carotid artery. And then coming 12 months later, and now with 250 annotated videos, we are now indeed able to detect and quantify the plaque, as you're seeing, generate that into a 3D model of the patient's specific anatomy with that plaque in situ, and automatically generate this into a report. So here we demonstrate the detection and quantification, but now moving on to characterization. So this is the image that Dr. Jackson presented. What we do is we apply normalization to these images before kind of feeding it into the AI. And then the AI's output includes the total plaque area, which also gives us morphology, as you see here highlighted in yellow. You can also get those juxtaluminal black areas, and the eagle-eyed among you will see that the juxtaluminal black areas were not detected initially in that total plaque area prediction by the model. So we did actually have to train an entirely independent AI model for the juxtaluminal black areas. In addition, we can detect the discrete or distinct white areas, which are perhaps the easiest to detect. And then we, based on this patient, the model actually picked up what was called an extreme morphology, in which we detected a carotid web, which of course have a propensity to act as a nidus for thrombus formation. And as a follow-up comment, the carotid web you're seeing here was not picked up on subsequent CTA, which is why we would recommend using both the ultrasound and the CTA imaging. So we have identified the key features of a plaque, and the AI can extract those. But to ascertain which of these features or combination of features are significant in stratifying the overall risk, we intend to perform a retrospective analysis to identify the relationship between those features and in patients with known cerebrovascular events. So once we've extracted the features and we've trained the AI, we will analyze that on a retrospective cohort to identify what is a high-risk plaque. And the next steps, Dr. Jackson.
Thanks, Jack. In association with Professor Nicolaides, you can go to the next slide. We are working to apply this technology so it is instantaneously available to assess carotid plaques in patients undergoing angioplasty and stenting in order to determine their risk of stroke. This is being done in collaboration with the Arizona Heart Foundation and Professor Ivo Petrov at the City Clinic Cardiovascular Center in Sofia, Bulgaria, pictured here. In addition, we are working alongside the Minister of Health of a small European country to develop an asymptomatic screening method for high-risk carotid plaque within their population. As ever, this is a continuance of the collaborations established by Dr. Ted Dietrich to further advance the safety and practice of endovascular procedures. Thank you.